Membranous nephropathy (MN) is an renal disease. Look at this picture, shows that inflammation of the glomeruli and disease mechanism. Detail going on. Introduction. Membranous nephropathy is a kidney disorder characterized by damage to the glomeruli, the structures within the kidneys responsible for filtering waste from the blood. The condition leads to the thickening of glomerular basement membrane, which impairs its filtering ability. MN is a major cause of nephrotic syndrome in adults. Definition. Membranous nephropathy refers to the progressive thickening of glomerular basement membrane due to immunocomplex deposition, leading to increased protein leakage into urine. It can either be primary or secondary to other conditions. Types. 1. Primary membranous nephropathy occurs without an identifiable cause, often due to autoimmune, where the body's immune system targets the kidneys. It is linked to antibodies against the PLA2R antigen on podocytes. Two, secondary membranous nephropathy occur as a result of other underlying conditions such as 1. Infectious, example hepatitis B, hepatitis C. 2. Autoimmune diseases, example systemic lupus, erythematosus. 3. Certain cancers, lung, colon, prostate. 4. Drugs, example NSAIDs, penicillamine. Causes. 1. Primary MN, the exact cause unknown, but it is likely related to an autoimmune process. 2. Secondary MN, caused by infections, autoimmune diseases, malignancies, or medications. Risk factors. 1. Age, more common in individuals over 40. 2. Gender, more prevalent in males. 3. Autoimmune disorders, example lupus. 4. Infections such as hepatitis B and C. 5. Certain medications, example gold salts, NSAIDs. 6. Cancer. Complications. 1. Nephrotic syndrome characterized by proteinuria, hypoalbuminemia, hyperlipidemia, and edema, to chronic kidney diseases can progresses to end stage renal disease ESRD, or thromboembolic events due to the loss of anticoagulant proteins in the urine. 5. Infections. Increased susceptibility due to protein loss. 6. Hypertension, often a result of kidney damage. Pathophysiology. In membranous nephropathy, aminocomplex are deposited in the susceptible space of the glomerulus. This deposition leads to the activation of the complement system, which causes damage to the podocytes. This leads to glomerular basement membranes thickening and disruption of the filtration barrier, causing proteinuria. Over time, continued damage can result in glomerulosclerosis and progressive loss of kidney function. Step-by-step pathophysiology of membranous nephropathy. 1. Triggering event. 2. Immunocomplex formation. 3. Susceptible immunocomplex deposition. 4. Complement system activation. 5. Podocyte injury. 6. Glomerular basement membrane thickening. 7. Increased permeability to proteins. 8. Resistant proteinuria. 9. Progressive damage and sclerosis. By understanding each step of this process, clinicians and researchers can better target therapies to slow down or halt the progression of the disease, with the treatments aimed at reducing immunocomplex formation and preventing further complement activation. Signs and symptoms. 1. Proteinuria, excessive protein in the urine. 2. Edema, swelling particularly in the legs and ankles. 3. Foamy urine due to high protein content. 4. Hypertension, high blood pressure due to kidney damage. 5. Hyperalbuminemia, low level of albumin in the blood. 6. Hyperlipidemia, elevated cholesterol and triglycerides. 7. Fatigue due to loss of proteins and overall kidney dysfunction. Diagnosis. 1. Urine test detect proteinuria, often in nephropathic syndrome, range less than 3.5 g per day. To blood test assess kidney function, creatinine, albumin levels and lipid profile. 3. Kidney biopsy confirms diagnosis by demonstrating thickening of the glomerular basement membrane and immunocomplex deposition. 4. PLA2R antibody testing, specific or primary membranous nephropathy. Nursing diagnosis. 1. Excess fluid volume related to impaired kidney function. 2. Risk for infections due to protein loss and immunosuppression. 3. Imbalanced nutrition due to proteinuria and altered nutritional status. 4. Fatigue related to reduced kidney function and protein loss. 5. Impaired skin integrity due to edema and immobility. Management and treatment. 1. Conservative treatment aim at controlling symptoms and preventing complications. 2. Blood pressure control ACE inhibitors or ARB to reduce proteinuria and protect kidney function. 3. Diuretics to manage edema. 4. Statins for hyperlipidemia. 5. Immunosuppressive therapy to reduce immuno-mediated damage. 6. Corticosteroids to reduce inflammation. 7. Cyclophosphamide for severe or resistant cases. 8. Anticoagulant in case of severe proteinuria to prevent thromboembolic events. 9. Dietary modifications, low sodium, moderate protein diet. 10. Kidney transplant in case of ESRD. Psychosocial medicine. Psychosocial support may include 1. Counseling for coping with chronic illness. 2. Support groups for patients and families. 3. Education on lifestyle modifications and medication adherence. Prevention. Preventive measures may include 1. Early detection. Regular screening for kidney function in individuals at risk, example those with autoimmune diseases. 2. Managing underlying conditions, control infections and treat autoimmune disease promptly. 3. Medication review, monitoring use of nephrotoxic medications. 4. Managing underlying conditions promptly, example infections, autoimmune diseases. 5. Avoiding nephrotoxic medications. 6. Regular monitoring for early detection and intervention. In conclusion, Membranous nephropathy is a kidney disorder that can lead to significant morbidity if left untreated. Early diagnosis and effective management are crucial to preserving kidney function and preventing complications like nephrotic syndrome and chronic kidney disease. Thank you. Have a nice day.